Okay, gram positive cocci are basically of three, like there are many types, clinically relevant three. Micrococci, very important. Staphylococci, very important. Streptococci. The streptococci, based on hemolytic parameters, are classified into incomplete alpha hemolysis, complete beta hemolysis, and negligible gamma hemolysis. Gamma are enterococcus, not a part of discussion. Alpha are of two types. Well, if I call the first one to be 1, the next one to be 2, and I join the ends of the two, they kind of form a V, right? So one of the alpha hemolytics is the very dense streptococci, and therefore the other one is Streptococcus pneumonia. Neither of them are the part of the discussion. Important part of discussion today, beta hemolytic streptococci. Now, this is a beta hemolytic streptococci. It has a cell wall, right? And there was this person, Lansfield. This person, he took out by a process one antigen from this cell wall called the C antigen, right? And basically she classified these beta hemolytic streptococci into many classes and named them based on alphabetical letters. So A, B, C, dot V. That's it. Just a small nuance. After GH, I mean like the two letters after H, that is I and J. So what I'm trying to say is two letters after H, I and J are not there in the classification, kindly mind it. So rest all of them are beta hemolytic streptococci. Of them, very important are A and B. And therefore beta hemolytic streptococci are grouped into two groups. Group A, beta hemolytic streptococci, and group B, beta hemolytic streptococci. And by the way, and this process of extraction of this C antigen, it needed something. What is that something? HCl. Now we already know that group A, beta hemolytic streptococci are strep pyogenes. And our discussion for today will be the group B, beta hemolytic streptococci, the famous streptococci, Streptococcus agalactiae. Okay, so many A's in the name, we do not need so many A. We can remove some A. That will make the mnemonic easier. There we go. Great. Starting from the right hand most side. So, infective endocarditis. What else? See? Infective arthritis. Please mind it, this is like many people can have such infective arthritis. When I'm specially talking about group B beta hemolytic streptococci mediated infective arthritis, I am specifically seeing two patient category: elderly and diabetic. T. Basically, these group B were reclassified, or rather further classified, not reclassified, further classified based on their capsules into T for 10 further subtypes. C means camp reaction is shown by this. I will tell you later what this is. L, interesting. Basically, L here stands for lipid. You see, there are some antibiotics which inhibit lipid component of cell wall. For example, bacitracin, and usually many gram positive people, they fall prey to this bacitracin, but God has chosen as agalactiae to be resistant to bacitracin. That is, this agalactiae is resistant to lipid mediated stuff. Okay, before we go to G, the last part, second last part actually, let's look at this A wala part first. See, so it has a tail, it has a tail. We can elongate this tail. See, you can elongate this tail, straighten it up. Looks like a 9, right? I will tell you what this is. Let's first look at G. G over here stands for 3 important things. First and foremost is that GIT, or gastrointestinal tract and genitourinary tract, have S. agalactiae as their natural flora, right? Suppose this is the gastrointestinal tract, then these will be the flora, S. agalactiae flora, right? This is the genitourinary, rather only the genital part of a woman, and this also has a flora. Now suppose eventually this woman gets pregnant and gets a baby, alright, planned for vaginal delivery. Baby goes out this way, on the way they meets S. agalactiae and therefore gets infected. So during the labor there will be infection with S. agalactiae. This will lead to early onset sepsis, like always, like within 1 week, right? Within 1 week, early onset sepsis. Sepsis of whom? So point is, like, it is very dangerous. It will be sepsis of both the neonate and also of the mother in the form of puerperal sepsis, right? So it's very essential to like prevent this. So how can we prevent this? See, thankfully there exists penicillin to combat these things. So the only factor for preventing such early sepsis, be it neonatal, be it puerperal, is like early administration of this damn penicillin. But point is, how am I supposed to know whether or not we actually have to give the penicillin? Easy. We take a swab, right? We take a swab from here and we check for group B beta hemolytic streptococci. If we find it positive, simple, give penicillin and therefore avoid all of this. Point is, when do we take this swab? We can take this swab anytime we want, of course, but what is the best recommended time? This is the best recommended time. This one. 9 months. So 36 weeks basically. So here we go. Okay, so point is, if we do not do all of this, what will happen? Simple, sepsis. But sepsis doesn't come alone. See, basically sepsis is followed by 2 things. What are those 2 things? For that, look over here. Gastrointestinal tract. This is the flora, right? It can migrate to 2 places, up, down. So in the brain, meningitis, in the lungs, pneumonia, and therefore not in the mother but in the neonate, such a sepsis can, like there can be sepsis, or there can be meningitis, pneumonia themselves, or they can be associated with each other. So like point is, there can be meningitis and pneumonia as well. Again, the treatment will be penicillin. Just one important thing to remember: if there is meningitis, we have to add another drug. What is that drug? So till now we have done the first part of G, which is GIT and GUT. Here comes the second part of G for gentamicin. This is the drug which we have to add. And lastly, last part, the last G. So the first G was GIT, GUT. The second G was gentamicin. The last G is this box. So what is the box? This is a G box. G for glycine, G for gardenlla, G for agalactiae. Oh my god. G for agalactiae, and G for campylobacter, cgejuni. Obviously it is J, but I've considered it to be G for phonetic components of the mnemonic. Anyway, so point is that all these three people can form glycine if they are given hippurate. So like simple words, hippurate can be converted into glycine by these three darned bacteria. So like if they ask me like which bacteria shows hippurate reduction test, I will say not only S. galactiae, our topic for the day, but also gardenlla and cgejuni. This was the third G. What else is left? Oh, camp. Nothing much actually. Here is a plate, blood agar, right? Eye streak, 2 lines. What are these lines? How to remember them? Here is how we remember them. A, B, C. Then kind of shift it. Shift it. So if we shift it over here clockwise, it will be A, B and C. And just for the sake of mnemonic, kindly rotate this. It will look like this, almost a G. So my point is, C for Clostridium perfringens gives out alpha toxin. B is for beta hemolysin, which is shown by aureus, S. aureus, and agalactiae shows C for camp factor. What is in common with alpha toxin, beta hemolysin and camp factor? All of them cause hemolysis. So what do? We take a blood agar. Blood agar has RBC. If I inoculate any of these bacteria, they're gonna lyse the RBC. We are gonna see that area as white patch on a background of red. So here is my S. aureus, here is my Clostridium perfringens, here is my dear little S. agalactiae. Of course I have made this part just to be representative. Kindly note that these areas do not meet, please. Anyway, so if I give such a arrangement, we can see arrows. What is this? Basically nothing serious. This Clostridium perfringens is giving out its own hemolysis. S. aureus is giving out its own hemolysis. S. agalactiae is giving out its own hemolysis. Here there is white over here, white, but at the junctions these whites get confluent and mix to form structures. Basically, if I see this, the confluence will look like this. That is all. So basically there is a name. S. aureus and A. galactiae confluence looks like arrow. A for arrow, and the confluence of Clostridium perfringens and S. galactiae looks like a bow tie, which we put around the collar. So C for C collar. Since this test involves S. agalactiae, whose the factor is CAMP, so that is why this is named as CAMP test. So basically, S. aureus with S. agalactiae is the proper CAMP test, while Clostridium perfringens cross S. agalactiae is the reverse CAMP test. That is all.